Thank you. So I did want to come on for a couple of minutes at the beginning just to give some background on how this project came about. So when the department went through the rate rebasing back in 2023, we did receive a number of comments through the public comment period requesting that the department review the way that we set rates. And I'm talking about the rates for waiver services at that time. So providers had indicated that they would really appreciate an independent review or bring in a contractor on so that we could review the rate setting methodology and look at how we compared to other states. So due to the robust comments that we received, the department did make this a priority and identified funding for this project. Guidehouse was selected as a contractor through a competitive RFP process, RFP being request for proposal. So right now we're in phase 1 of this project, and in phase 1, Guidehouse are looking at the rates that are being set, how they're set for behavioral health services, long-term services and supports, which is what all this group here is for. They're also looking at the rates for the federally qualified health centers and the non-emergency medical transportation in phase 1. So we're very excited to be working with Guidehouse. I'm sure Purna and team will give a little bit of their background, but they have a lot of experience in this work. So Guidehouse will be using many sources in conducting their research. But one that is very important is the information that comes directly from all of you as providers. So we do recognize that completing this survey is a lot of work for you all, but this is your opportunity to directly report your costs for providing LTSS services to Alaskans. So it's a great opportunity. You have a really important role in informing this work. And I just wanted to come on and let you know how important that your input is. And we really would appreciate you taking the time to do the survey. You will see that Guidehouse are available to assist along the way. So you're certainly not out there alone. But we appreciate your involvement, and I will turn it back to Purna. Thank you.
Thank you, Caroline. And I will say the Guidehouse team is looking forward to working with DOH as well as this group of providers on the call today. Before we jump in, just a quick introduction about me. My name is Purna Suresh. I am an associate director here at Guidehouse. And as most of you may already know, Guidehouse is working with the Department of Health on a wide range of studies. And our goal today is to focus on the long-term services and support study. And more specifically, to support the study, we are conducting a survey to collect information from providers on wages, costs, and a lot of service delivery information. So the training today is specifically for us to briefly go over the goals of the study as well as the survey and the several areas of reporting within the survey. We will also cover some of why we are asking for the information and how the information may be used. So just kind of jumping into the next slide before we, dive into the individual areas. We'll start with just providing an overview of the scope of the survey and how to access the survey if you do not have access already, but if you do, just a quick reminder. B, we will provide an overview of the rate study itself. And then C, we will spend a good amount of time going through each section in the survey, and we will stop for questions. And this is meant to be an interactive session where you can ask us questions and we can help address them. And we are also hoping to provide some tips and tricks on how to respond to the survey. And then we will wrap up with just the logistics and, in terms of the timeline and also any technical assistance that can be offered to you all on this call beyond today's training session. So as we jump into the training, I'll just move to the next slide and just wanted to provide some background on Guidehouse. And I know Caroline mentioned this a little bit already, but I did want to say that Guidehouse has worked in over 17 states on community-based rate studies. And more specifically, we've worked in a majority of these states on long-term services and supports rate studies. So we're hoping to draw from some of those experiences, especially some of the frontier states as part of the study, but also I will note that Alaska is definitely unique and then different from any of the other states. So where applicable, we're hoping to bring some of those takeaways, but that also emphasizes why this provider survey is extremely important. So we are able to get information and data from you all directly. So just wanted to provide some background before we jump in. And I will say before we get into the survey itself that today's session is being recorded. For those of you all joining us and listening in, and a recording of this training will be distributed after the training is completed. And another thing I'll also say is that this is the second of the 2 training sessions we've been conducting. The agenda for both training sessions are identical. So if you have attended the previous training and you want to save yourself some time today, you can feel free to drop. But if you want to still stay on both training sessions, you can feel free to stay with us. So without further ado, I am going to jump into just, should your organization complete the surveys? Why is everyone on this call, right? So jumping into the next slide, wanted to be more specific about, which provider organizations should be responding to the surveys we are going to be discussing today. So firstly, if your organization provides any long-term services and supports under the Department of Health, then the survey aims to collect your organization's costs, and it is included as part of the rate study. But also more specifically, if your organization provides services under one or more of these 3 programs outlined here, which is personal care services state plan, community first choices state plan, and then we also have the 1915C home and community-based services waivers, the 5 waivers. If your organization provides any of these services under these programs, then this survey is meant for you. Now, on the next slide, I did want to caveat that you'll see a few services missing here, and more specifically, if your organization provides only care coordination or targeted case management services under the 1915C waivers, Community First Choice, or the TEFRA program, then there is a separate survey that will be coming to you in the near future at a later date. We are in the process of conducting a focus group with a few case management providers as part of designing and finalizing that survey, which is why we've reserved the survey for a later date. So if your agency only provides care coordination or case management, then you can feel free to leave this meeting. Of course, if you want to listen in, you can do that. But if you only provide care coordination or case management, just know that we will not be discussing any specific areas related to these services. But we do identify that there are several agencies that provide care coordination or case management in addition to other services. And if that's the case, we ask that you continue in this training session, especially because we will be discussing a lot about all the other services that are in scope. All right, so that's just a call out for care coordination. More to come in the near future. Just keep an eye out for that if you are a care coordination or targeted case management only provider. And then the last piece of information I wanted to share is that if your organization provides only services that are billed at cost and they are not based on a standardized rate, then the survey does not capture any of that information. The survey does not include specific questions on services like, personal emergency response system, environmental modification services, or specialized medical equipment services. Since these services are based on spending caps and allowances for these services, these are part of the rate study, and they will be discussed as part of a long-term services and supports rate work group session that is happening outside of this training session. So more to come towards the end of the rate study on the results, but nothing is included in the survey as it relates to these types of, we call them pass-through services or services that are not based on a standardized rate and reimbursed at cost. All right. That said, just moving to the next slide, I do want to provide some more clarification because we have received a few questions about, the rate study survey versus the annual cost survey. We are aware that there are 32 providers that submit an annual survey to DOH. And we did want to firstly clarify that this is the rate study LTSS provider cost and weight survey that Guidehouse is administering in support in collaboration with DOH. So this is separate from that process. And you may have a question about if you do submit that annual survey, you may have a question about whether you should consider participating in the survey. And we did want to say that yes, we encourage you to participate in the survey. It is a one-time survey as part of the rate study. And in terms of the details of the survey, this survey is meant for all service providers. And they're invited to participate in the survey, of course, with some of the exceptions that we've already discussed on the previous slides. Secondly, the survey aims to capture most recent information. So for services and benefits, we do ask for the most recent quarter that just wrapped up as of September this year. And so that's something I wanted to emphasize, that these are not, these are not audited surveys. These are meant for you to report the most recent information. Of course, if you do submit cost surveys, if you do have audited financials, we would encourage you to use that as a foundation to report information here. But you will see that the survey dives into a lot of the details, a lot of the nitty-gritty that goes beyond wages and costs, also as it relates to service delivery. So I wanted to specifically mention that. And then the last is the survey is also designed trying to get standardized, consistent, and comprehensive data from all providers. So that's also one of the key aims of the survey, to be able to capture information from providers of all size, all types of services across the state. And it's aimed to be a data set that captures very standardized information, which will allow us to then analyze that information further for development purposes. And then the second caveat also is that I know there are a few LTSS provider agencies that also may provide behavioral health services. And your question may be, should you respond to this survey in addition to the behavioral health provider cost and weight survey? And the answer is yes. This survey is focused only on capturing LTSS programs and services and the corresponding costs. The behavioral health survey that is part of this rate study, but it's not part of the LTSS rate study, it does not capture costs for LTSS. But I did want to flag here that if you're identifying that your organization is submitting identical data to both surveys because of how your organization operates or how your services function, we ask that you send us an email to this email ID if you find that it's duplicative, so we can work with you to eliminate or avoid those redundancies, and we can determine how to best leverage data reported in one or both surveys, right? So before I jump in further, any questions or comments about the scope and the services that have been identified as in scope for the survey that we are discussing today? And over the course of today's conversation, please feel free to raise a hand to share a comment or a question. And also, please feel free to use the chat box to type in a message, leave us a comment or a question. Our team is monitoring both, so we will be sure to address them as and when we cover this conversation. All right, sure. And I see that there may be some connectivity issues for some folks. So yes, we will, I'm going to try my best to reiterate some of the details we have covered. And then if you have missed some specific details, just know that this meeting is being recorded. So this will be available after the training session. Everyone who have attended this training and have received the survey will get an email with a recording of today's training along with the material that was discussed. So just know that this is coming after the training session. All right, but I'm keeping an eye on the clock. Again, if several people are not able to hear me, please feel free to leave that in the chat. But just know that you'll have access to the recording after the training session. And you can also reach us at our email ID if you want more one-on-one discussions with us about the survey. All right. So in terms of the survey materials, if you do not have the survey, so I think that's a good segue into the next section. So let's move into the next slide and talk about how to access the survey. So everyone on this call should have received the survey, or someone in your agency or organization should have received the survey on October 11th. And this is what from this email ID, akratestudyltss@guidehouse.com. And this is a screenshot of what the survey looks like. You'll see two attachments with a pretty lengthy email that explains to you what the survey includes and who should or should not be responding to the survey. And if you have not received the survey, we ask that you drop an email to akratestudyltss@guidehouse.com. This is the email ID we are monitoring, and we will, if you haven't received the survey, we will be able to get you a copy of the survey along with all the accompanying material if you're able to drop an email to us. I just put the email in the chat box, so just keep that email ID handy. You will need that both to access the survey, but also as you respond to the survey, if you have any technical questions, you can reach out to us at that email ID. All right, so moving to the next slide, once you've secured access to the survey, we've given you the subject line, the email ID. On the next slide, we outlined that there are two attachments. One we call a general survey for all providers, and the other one is a meals only survey. So if your organization provides only meal services, we ask that you take only the meals survey, because you do not have to worry about all the other services that are captured in the other survey. However, if you are a multi-service provider that provides several services, then we ask that you respond to the general survey. The general survey includes all services as well as meals. So if you provide meals in addition to other services, just take the general survey and that should cover your organization. So just reiterating that if you're a meals only provider, survey B noted here should suffice. If you provide several services, then look at survey A. All right. And once you save the survey, open it up, you should hit the button enable content, so then you can start responding to the survey. But we particularly mentioned that you click that enable content button because that's only when you'll be able to access the contents of the survey or fill the survey in Excel. All right. So jumping into the background of the survey, we'll move a couple of slides down, and actually we'll start with the background of the rate study itself. So just some background information. While we've covered the services that are within the study, I also wanted to broadly share that these are the 6 programs that we are looking at as part of the long-term services and supports rate study. And these are essentially programs that fall under the Division of Senior Disability Services, as well as the Division of Public Assistance. So it includes the 2 state plans, the personal care services and community first choice. And then in number 3, you have the 51915C waivers and the whole host of services, both residential, non-residential services that fall under the waivers. And then we have targeted case management state plan, number 4. And then at number 5, you see intermediate care facility for individuals with intellectual disabilities. We are aware that there is no ICF in the state at the moment. This is just a small portion of the broader rate study to identify what the operational costs of an in-state facility could look like. Well, that's also part of the study. This is not represented in the survey, but this will be a discussion on the side with the rate work group providers, but also more specifically for Guidehouse to review as part of the study. And the last is TEFRA, but more specifically, only care coordination TEFRA is included in the study. We know that TEFRA includes a whole host of other services that are not part of the study. And again, today's survey only deals with the services highlighted in green over here. All the other services, either they're not included as part of surveys, or they will come as part of the care coordination or case management survey in the near future. Right. So with no comments or hands raised, let's move to the next slide. And let us talk about essentially the goals of the study. So these are some overarching goals in terms of looking into promoting access for all Alaskans from a rate setting perspective, including supporting budget sustainability on the long term for the program. And then while the study also includes looking at the current programs, the existing methodologies, but also the goal is also to discuss what the future of these methodologies may look like and how they may compare to other states that offer similar services and operate similar programs. And some other key components as part of the study is also to see rate differentials, whether it's based on geographies, based on the unique geographic complexities between the hubs and the villages within the state, but also accounting for differences that may occur based on levels of needs of individuals that receive these services, based on age groups or based on resource needs, and in some cases even based on provider requirements or qualifications as it may be applicable for certain services. And our goal will also be to look at whether the rates for similar services need to be the same, whether equity may need to be established. And one thing with the existing LTSS Alaska rates is that Alaska already mostly does that, wherein most of the similar services across programs have the same rate if they are meant to be the same from an activity or a service delivery standpoint. But we will be taking a second look at it to ensure that that still holds, or whether it should hold going forward. And then a key part of it is engaging with providers. One part of it is today's meeting, today's training session, but also the data we will get from you from the survey is a way through which we can speak to you all and get your information, more concrete information that can inform the rate development process. And also another key goal, which I know is also DOH's key goal, is engagement with tribal health organizations, which will also be a separate part of this rate study. All in all, this information will help inform a comprehensive rate analysis and recommendations that will go in the form of a final report to DOH in July 2025. So this July 2025 deadline is essentially to get to the end of the rate study process, but there will be more that will come after it from an implementation standpoint to actually operationalize the recommendations that we make to DOH. That will come after July 2025, and that's not included as part of the goals here or the deliverables, but it is an important piece I did want to note to everybody on the call today, especially because you may have questions about like what comes next. And this is our first step. The next step will be implementation once the outcomes of the study is determined. Right. So with this, we will be jumping into the survey. I will pause here to see if there are any questions or comments. And Sean, we can move to the next slide, but I'm going to quickly take a look at the attendee list and the chat to see if we have any hand raises or comments pouring in. Right. Brendan, I see your hand raised. If you want to ask a question or share a comment, please go for it.
Hello, I have not received this survey. And also, I'm unable to enter the chat. It says chat is only available during the meeting.
Right. So Brendan, so firstly, with regards to the survey itself, please send us your email ID, or you can just send an email to the email I put in the chat box. We will get you a copy of the survey as soon as possible within the next 12 to 24 hours at the latest. So that's one thing I wanted to mention. We can get you access to the survey. The second is from the chat box standpoint. I see that most folks are able to send us messages. So I'm just going to pause here to see if anybody else is facing the same issue. If not, Brendan, the only solution I have for you at this point is if you could try to rejoin the meeting. Or as an alternative, please feel free to raise a hand and we're happy to address your comments. But I'll pause it to see if anybody else is facing an issue with leaving comments in the chat. If you are, please raise a hand, or I think that's the only way through which we may know if you're not able to communicate with us. It seems like, so Brendan, I would recommend you try rejoining this meeting. And if you still don't, I did want to say that this meeting is being recorded and we are happy to offer more one-on-one assistance to you. If you're able to drop us your email ID and send us an email, we should be able to contact you with more information. Right, okay. So let us jump into the provider cost and weight survey. So starting with an overview of the survey, and you'll see the goals of the survey overlap quite a bit with the goals of the study, because the survey is aimed to be more comprehensive, to get a lot of information that will support the rate study. So the key piece of information, of course, is to get provider cost data, which will serve as the foundation for the rate. And when I say cost data more specifically, well, we do ask for a lot of cost-related questions. Some key pieces are things like wages and provider fringe benefits, which is provider compensation, and it serves as the foundation for the rate. And that's one of the biggest pieces that we ask of all providers within the surveys. The second is to get uniform inputs. Like I said, the survey is standardized in a way to get uniform input from you all. So we're able to use that for rate model or rate component development. And another key piece is the inflationary impacts on costs and wages, especially as it relates to direct care worker wages. And if there's one thing that the pandemic has taught us and the recent economic changes is essentially how there've been spikes and changes in the wages over the, in the recent past. And while this may have changed a little bit in the past couple of years, especially post COVID-19 public health emergency, we do recognize that sometimes these wages really change month to month, and especially with changes in funding from SDS and DOH as well at the start of the fiscal year, we've also aimed to ask for most recent wages as of the most recent quarter. And we will also be looking into several, industry metrics on trending wages forward to a point of implementation, because implementation of these rates are probably, it's maybe a couple of years down the line. So essentially inflating these wages and trending these wages and costs forward to a point in time that is reflective of when the rates may be implemented is a key part of the rate study. And we also ask a few questions in the survey that may give us insight into how the wages offered by our agencies have changed in the past 2 to 3 years. A couple of the things that the survey also does beyond costs is get insight into service delivery. So we gather information on the different types of billable and non-billable activities your agencies may, the staff in your agencies may perform for different services, and especially for the non-billable time that is integral to service delivery. So to account for the non-billable time, to adjust the rate upwards, we ask for information about the time that's spent on different types of activities. We also ask for information on, how the wages may vary depending on different borrows and census areas within the state, to account for potential geographic differences. And then ultimately, the goal is to use this information from the survey to establish equity as it may be applicable in the rates, and also soliciting general feedback as it relates to service delivery. So we ask for information like number of homes you may operate, the staffing ratios in those settings, whether those vary depending on time of day. And also overall, a few questions that provide insight into things like transportation, which could also vary depending on where services are provided, and any additional information that you may want to provide to us that may not be explicitly captured as a quantitative metric within the survey. So overall, lots of goals, and ultimately the reason we ask for this much information is because that immediately feeds into the rate development process. So jumping into the next slide, just quickly covering the different areas within the cost and wage survey. If you've received the survey, you've seen this, or you may see this, which is there are 6 tabs that cover, we start with very broad information about, tell us about your organization and, whom we should contact, your broader revenues. And then we start slowly getting into the nitty gritty around like the total costs, the different types of services your agencies offer, wages and benefits, staffing patterns, additional information. But I'm giving you an overview at this point in time, but I did want to say that we will be going into each of these sections over the next hour. So if you do have any specific questions, comments, we welcome your questions and comments as we go through each section in the survey. And the key point I wanted to make here is you'll see in the last column here, we capture how this information translates into the rate setting process. So for example, in the total costs tab, we ask a lot of information about the different types of costs your organization may incur as it relates to administrative program support costs. That in turn will feed into, the rate development process as an administrative cost factor or a program support cost factor. Similarly, in tab 4, we ask for wages. So the baseline wages, we ask for baseline wages, but we also ask for, do you offer any overtime pay or supplemental pay that needs to be taken into consideration? Because we know that wages are not just, baseline wages, but they may also include any type of like overtime or supplemental pay that's offered above and beyond that we should account for. So these are just a few examples, and we'll be going into each of these sections. So we'll have a lot of time and the opportunity to, dive into the individual questions. But the key piece of emphasis here is that there are specific reasons for each piece of information asked in the survey. And in terms of the time period for this data, you'll see that there are, more broadly speaking, we ask for the most recently completed fiscal year for your organization. And then in some cases, we ask for the most recent quarter. So in the cases where we ask for the most recent completed fiscal year, we say that because we know that each provider agency may go by different, fiscal year cycles. Some may go by a calendar year from January to December. So if that's the case, then you give us your data from January 23 to December 23. Some agencies may go by state fiscal year. So you may run from, say, July 1st, 23 to, June 30th, 24. So in that case, we ask for your data for that cycle. So you will see in the survey, there's a placeholder for you to identify your fiscal year cycle, and we ask that you report information for that cycle. But there are specific areas like wages in tab 4 and benefits in tab 5. You'll see the ones in green here where we ask for the most recent quarter, July to September 2024. For the reasons I've already mentioned in that for compensation as a whole, which is wages plus benefits, we are hoping to get latest data as recent as the past quarter, just because we understand that there may have been changes in wages after the start of the new state fiscal year, especially with increases in rates in many cases. But also we identify that you may have chosen to change some of those wages in your agencies. And there are also a couple of questions that are more forward looking on whether you anticipate changes, especially if your fiscal year has not ended and you may choose to do that, maybe next year. So we ask for the type of information that's more forward looking. And some of these areas have also been expanded based on feedback we have received from, a rate work group, which is comprised of providers and provider associations, on including information like turnover rate and any unfilled positions. So we get better insight also into any workforce challenges your organizations may experience, in addition to more quantitative information about like costs and wages and benefits. So we will be jumping into for the next section now, we will be switching to the actual survey workbook. So those who have seen it, this will look familiar to you. Those who haven't seen it, you'll get the chance to see it right now. But also we will be sure to get you access to the survey if you're able to drop us a note. And as Sean switches to the survey workbook, I will pause here to see if there are any questions, comments up till this point before I jump into the survey sections. Right, I see your hand raised up, Tyler, if you want to ask your question or share your comment.
Hi, yeah, I'm wondering how this is going to account for services that have such horrifically low rates and have for so long with such high administrative burdens that there's hardly anybody providing them currently in the state. For example, the agency-based personal care services are borderline non-existent throughout most of the state of Alaska because the administrative burden is very high compared to the rates to provide them or reimbursed for them. And so I don't think you're going to get a lot of good information about that service. But if you want it to be accessible to folks, it really needs to be looked at.
Yeah. So Tyler, that's a good point, which is why I'll say that this survey is one piece of information we're looking at to inform the broader rate study, right? So two things. Firstly, as part of this rate study, we are working with a rate work group, which is comprised of nearly 20 representatives from provider organizations and associations that are a key part of the discussion as well. So when we get the results from the survey, for instance, we'll aggregate it, discuss it with that group. And ultimately, once the rate study is done as well, there'll be a final report that documents this for everybody to look at. So that's one key piece I wanted to mention, because if there are, information that may not come through the survey, whether it's services that may not be very utilized, but we may want to think through it from a rate standpoint to see what changes may need to be made to make that service potentially attractive, right? Or if there are new services too. One thing we didn't talk about too much today is like a couple of new services being introduced. But those are things that DOH has put on our radar, and it is an important part of the study. Tyler, I wanted to mention, while I agree with you that the survey may not capture all this information, just note that that is a key part of the study that we are discussing, as part of the rate setting process. This is the first step, which is collecting all the data we can, whether it's from providers, which I think is the biggest piece, or from the state. We are also working with the state to get information they may have, whether it's quantitative data or qualitative information about the history of the program and utilization of the program. So those are things we are looking at. And like, for example, the claims is also something we're looking at as part of doing a fiscal analysis eventually that may tell us more about the utilization of services. So I just wanted to overall add that the survey is one piece of it. It aims to capture a lot of information, yes, but it may not answer everything we may need from a rate study standpoint. And that's also why this rate study is more of a comprehensive approach that goes beyond, written data. And there will be several discussions with the rate work group of providers that essentially we'll have these discussions. And I did note that I didn't want to mention that I made note of the service you mentioned to us. So we will, as part of those rate work group discussions, we'll have more, information that will transpire through those conversations. All right. All right. Any other questions or comments? I see Sean has the workbook pulled up, so I'm going to jump in, but anyone can feel free to interrupt me or put a comment in the chat box. We are keeping an eye out for it, and we will be sure to address them as and when we go. All right. So jumping into the provider cost and weight survey, you'll see that this survey has essentially 6 tabs, but actually 7 tabs, because the first tab, which is called the overview tab, should give you like a bird's eye view of what is expected in the survey. So the top, it'll kind of give you the scope, which we've discussed most of it already, our contact information, but also you'll see there are some color codes over here, which tell you, by looking at these different colors in the survey, what you may, what you may interpret those cells to be. So for example, some of these cells which are golden color, providers are required to fill those cells. Some that are gray, we say that those are auto-populated, so you don't have to fill them, right? So we will go on some of these examples as we cover the questions in the survey, but I will say anybody filling the survey, whether it's you or someone from your agency, we ask that you read this tab, especially the color codes, because it may address some of the questions you may have as you go through the survey. All right. And then the same tabs that are outlined at the bottom, so you can navigate to them. But without further ado, I am going to jump into the organizational information tab, which is the first tab. And you'll see this tab is more broad. It asks you for, your organization's name, if you are part of an umbrella agency, identification numbers. I know there are some larger agencies that have several IDs. So we ask for the Medicare provider ID, but also any alternate IDs. Contact information is important. We do ask that any contact information you identify here should be someone in your agency that we could potentially circle back to who may be responsible for the survey, because once we get these surveys, we also may go through a process of circling back to you for any clarification, questions. So we ask that you include the relevant contact information here, so we may use that for communication purposes. The rest of this tab is really around organizational details. So this is more broadly for your organization, how many sites you may operate, number of participants you may serve, or clients you may serve rather. And you'll see here that this ultimately, we ask that you submit one survey for your agency as a whole. So if you do have multiple sites, so we ask that you still submit one survey, but you can identify all the sites and all the information corresponding to all those sites just within this one survey. All right. And same question in the chat box. If you have multiple provider IDs and multiple services, you still submit one survey. So it's one survey per agency, per provider organization. If you have multiple sites or provide multiple services, you would still complete only one survey. As we go through it, you will see that we will kind of share with you where we demarcate the different services, where we differentiate questions specific to the services. But for now, we're just talking about, like just information for your organization as a whole. All right. And then organizational revenues, this is just like overarching revenues. We ask that you identify the most recent state fiscal year. I mean, your agency's fiscal year, and that's the same year that you'll follow across all tabs. And we also ask for revenues across these different buckets, whether it's specific Medicaid programs, TEFRA, Medicare, or any private pay, any other forms of revenue. We also have an other bucket where you could really identify any other revenue sources you may have. But all in all, the aim of this tab, even the revenue information is, now this information is used for rate setting purposes directly, but it's mostly A, to understand the scale of your agency, and B, to know who you are and whom we can contact. And also, if we need to crosswalk this information into any other data we are getting from the state, whether it's, claims, for instance, the information you give to us here will help us with that sort of like crosswalking and triaging across multiple data sources. All right. So another quick thing I will say, that you'll see these gold cells, like I said, are the cells you need to fill. So if you do try to fill any like gray cells, for instance, the survey is going to give you like a pop-up error that says, like you cannot enter this information or try to enter the password. So it is done for a reason. If that gives you a pop-up, it means you don't have to fill that cell. So we ask that you only fill these gold colored cells or the blue colored cells for additional information. And the second thing is also there are validations introduced in the survey. When I say validations, for instance, if you go to the phone number cell, for instance, and you try to enter any number that's not 10 digits, it will give you an error and ask you that you enter, a 10-digit number. So for instance, like Sean is basically typing some letters here, which says, please enter 10 numeric, like 10 characters or 10 numbers, right? 10 numeric characters. So you'll see this in some parts of the survey. Some have them, some don't have them, depending on what's required of the cells. So we are hoping that also makes the process a little more easy as you respond to the survey. So if you do enter something by mistake, or someone in an agency enters something by mistake, the survey should flag that for you. But there are also several areas of qualitative information that is really up to you as to what you provide in those cells. So there's no sort of validation introduced in those cases. So just keep in mind that if you do get a pop-up error of some sorts that says you cannot enter information, it's because it's a gray cell or it's an area of the survey that does not require information from you. Right. So with that, we'll pause for questions. I see we have a question from Teresa. So Teresa, if you want to unmute yourself and ask or share.
So just a quick question under organizational details. So it says, how many sites does your organization operate? Are you specifically talking about, we have a home that's not licensed to take Medicaid. Do you want information on that home, I guess?
So that's a good question. This whole survey is essentially meant for, essentially for your agency. So it's meant specifically for the Medicaid services. But for this tab alone, you can provide information for, all sites you operate, whether they're Medicaid or non-Medicaid. Because even if you see their revenue, for instance, we ask for Medicaid revenue, but we also ask for other sources of revenue. So for the sake of just this tab, you can give us information, even if it goes beyond Medicaid. It can be sites that your agency broadly operates for services that are not Medicaid, but that would apply only to this tab, because the subsequent tabs you see, we're very specific about the information we're asking of you. We ask for specific programs, specific services, but to answer your question directly about this tab, yes, you can provide sites that go beyond the services and the programs and scope for this study.
Okay, thank you.
And I will say that in a couple of weeks, we will be releasing a frequently asked questions document. We are gathering questions from today's conversation, the previous training session, questions we're getting in our inbox. So beyond instructions in the survey, we are also planning to send out an FAQ that will have some of these questions you're asking us. So the broader provider base can also benefit from the responses and the questions, as well as the responses that we are reviewing in today's conversation. Okay. I see no other questions or comments, so we will move to the next tab, total costs. So in the total costs tab, this tab is definitely one of the sections where we ask for more information than not. You'll see as we go through some of the other tabs, there's less amount of information, but this one's purely quantitative, aims to get your organization's costs across the different programs that you provide services under. So before we jump into some of these individual areas, I will say that, when you look at this tab, there are some overarching instructions we've mentioned at the top that may guide you as you respond to this section. And if you hover over the cells in the rows, so for example, if you look at cell B11, that, and Sean, if you can go to cell B11 to the left, you will see that we have instructions for, every single cell in this survey that essentially gives you more information on the different types of, cost, essentially cost areas that we're asking of you within this survey. All right. But if you hover over these cells, even the yellow cells, you will see that we have instructions. So you'll see to the left, if you hover over salaries, it tells you the type of information you need to be reporting. So we're hoping when you respond to the survey, you can hover over the cells that gives you instructions on what's expected of each of these cells. All right. And a couple of other quick things, when you hover over the yellow cells as well, it tells you what you have to report here. But all in all, what we're asking for you to do is allocate your costs just for the services that are in scope for the study across these different columns. So column D, which is just total general ledger, this is meant to be essentially your agency's total costs across all services and programs that you provide. But if you go through columns F, G, H, and I, these are more specific to the services and scope for the study. So for example, if I take column H, which says expenses allocated to state plan programs, here we are asking for your personal care services and your community first choice expenses. Then if we're asking for the waiver programs, then what we're really talking about is all the expenses under the waiver program. So residential, non-residential services, as it relates specifically to the 1915C waiver services within in scope. Same with TEFRA's only care coordination. So if you provide any of the services as an agency, whether it's broader employment services or other TEFRA services, for instance, we ask that you report that under the other programs. So the last column here says expenses allocated to other programs. And so if your agency incurs any expenses that are not in scope for the study, whether it's some other TEFRA service outside of care coordination, or I know several agencies have employment programs, say vocational rehabilitation programs, for instance, that may go beyond what's in scope for the study, then we ask that you specifically report that under other expenses. And the key reason for that is we do not want to be, double counting, but also B, like accounting for expenses that do not apply for the services in scope. And the last piece of information I'll also say here is we have a separate column for room and board as it relates to like the Medicaid waiver services. For instance, room and board is an unallowable expense. So we ask that you separate that. So, we clearly know what is, room and board costs within your agency is. So that's kind of the goals of these columns. Truly the columns where you report costs for programs and services in scope are F, G, and H. The other columns are really unallowable costs or costs that are for other programs your agency may operate. And overall, if you actually allocate all expenses between columns F through J, which is, everything after that 100% in the example, the general ledger, that the column which says, 100% in the example case, it will turn 100%. So you'll see in some rows it's 0 because no costs have been allocated. But if you do allocate those costs out, that will turn to 100%, which tells you you have allocated all of your agency's costs across the programs that are both in scope for the study, but also not in scope for the study. All right. So I see a few questions that I'm going to address before we jump into some of the individual areas. So just repeating that this session is being recorded. A recording of this session will be made available offline. You will get an email if you attended this training or if someone in your agency received the survey. You will get a link with the training on the DOH website in the coming week. All right. And then a couple of questions here about if a provider provides employment supports, does the site of employment count toward the number of sites operated? Yes, so if it is a site that is operated by your agency, in that case, yes, we do say that that counts as a site. So if it's a site that's operated by your agency, then we ask that you identify it as a site that is, your organization site, if you may. Another question, which is if your organization operates, if you operate a care coordination agency, are you considering care coordination wages as direct care for the purpose of the survey? Yes, that is correct. If you essentially a care coordinator is considered as a direct service provider. But I'm just re-emphasizing that the survey we are reviewing today, it does not include care coordination or targeted case management services. So if your agency only provides those services, this survey is not for your agency. We have a separate survey for care coordination or case management coming up in the near future. But overall, yes, like this survey aims if direct care staff are essentially staff that are responsible for providing face-to-face services or services directly to clients. So I think that's a good segue into the rows that we've identified over here. So if you take the salary section, so there are 5 broad sections in the cost tab. The salary section essentially aims to get salaries for direct care staff, supervision staff, maintenance staff, administrative staff. So for example, if we say direct care staff, these are staff that are, for example, in the case of, let's just say an adult day service, for instance, if there's a direct support provider, a DSP that's providing that service, and the DSP is the direct care employee. So we ask that you kind of include all the salaries associated with those direct care staff in that line. Similarly, for supervision, if someone supervises the DSP or DSP supervisor, in the case of employment services, maybe an employment specialist supervisor, we would include those types of salaries in that line. Same would apply to other types of expenses here, whether it's maintenance staff or administrative staff, staff responsible for the operation of your organization, and other, even contracted. We also have contracted staff that may be external to your agencies. But the gist over here is that you report salaries corresponding to the role that staff may have in your agencies, but also we recognize that in some smaller agencies, direct care staff may wear multiple hats. Someone may serve in an administrative role, but they may also be a direct support professional, or someone may be a DSP as well as a supervisor, right? So in that case, we ask that you make allocations between these categories based on the amount of time they may spend in that role. And that instruction is also included in the, the top, where we have 4 bullets over there. Bullet number 4 clearly explains the same instruction that I just mentioned to you on how you can go about making those allocations. Same with the general cost allocation strategies. In some cases, some of your agencies may not clearly, track within your agencies the expense allocations across different programs, state plan programs, waiver programs, TEFRA, etc. So if that's the case, we ask that you use a couple of different strategies. Again, I'm giving you examples, but this may vary from agency to agency. You could either allocate them based on revenue for each of those programs, or you can also allocate them based on personnel salaries for staff that provide services within those programs. So there are many ways in which you can go about allocating them, but we still ask that you allocate them so that we are looking at pertinent information for those specific services, and this information can be used for rate setting. All right. And if you scroll down this tab, you'll see several different cost reporting areas, taxes and benefits. So it's pretty comprehensive for you to report your, different types of insurances, whether it's health, dental, vision, retirement plan, workers' compensation, which I know is a common question we've received from providers. So you can allocate all of that. And if you hover over the cells, it also gives you instructions on the types of expenses you can report in those lines. And then if you scroll down, and Sean's demonstrating, when you hover over them, you really see like this pop-up that tells you more, right? And if you scroll down with administrative expenses, these are really expenses that are required for the operation of your agencies. So we have a lot to do with office supplies, equipment, licensing and certification, any IT, information technology costs. It's pretty extensive, but we also have an area where you can report other costs if the costs we have identified here does not fully represent the costs your agency may incur. And even in these areas, you'll see we do have some costs like lobbying expenses that are explicitly split because we know they may be unallowable in some cases. So we've tried our best to kind of split them out based on our knowledge of how we see, costs may be tracked. But we do encourage you to try to allocate them within these buckets as much as possible. But you can also use the other expense areas in case you are in a fix as to which category may be most applicable for some of the expenses you're contemplating. And as you scroll down, you'll see program support expenses. These are expenses integral to your agency's required for service delivery, but it may not necessarily be direct care costs. So like activity costs, any supplies for those activities, and any technologies that may be used. For example, like for certain therapeutic services, maybe some technologies or devices that may be used that you can identify here. And also we ask for transportation more specifically. And towards the end of the survey, we do capture other sort of capital costs, whether it's like equipment, vehicle, and utility costs. And more specifically, some common questions we get in this area is we do ask in row number 43 for you to report the total square feet of your facilities. So if you do operate multiple sites, we ask you to just add them all and give us the total here. And in the next line, we asked for the admin space. And this is related to the, any administrative functions you may have and the space associated with it. So this will typically be a subset of what we have on the previous row. So this is specific to administrative spaces, and the previous one was just your total square footage across all the facilities or the sites that you may operate. This is a common question we get. We will be putting it in the FAQs, but I also wanted to explicitly share with this group that row number 43, just give us the total across all sites. And row number 44 should be specific to that administrative space, which will most often be a subset of that total square footage you report in row number 43. Right. But outside of that, several questions about vehicle expenses. And we also have a lot of questions about like depreciation, because we recognize the, the value of equipment that may change over time and is spread over time. So those are the types of questions we also ask of you in this tab. So you'll see it's pretty comprehensive. And there are also areas where we have these specify boxes where you can write to us about a little more about what those expenses entail, especially if you're allocating other expenses in these other buckets. We ask that you, in the specify boxes, you write to us what those expenses entail. So we also have a better understanding of what the other expenses are beyond the, the categories that are explicitly mentioned in the survey. Right. So with this, we wrap up this tab. I'll pause here for any questions or comments before we move to the next one. All right, I see none. In that case, we can proceed to the next tab that focuses on wages. So in my eyes, this is again, this and the cost tab are some of the key pieces of information within the survey that, we think that your agencies especially are best positioned to give us latest information on. So this tab captures wages for direct care staff and supervisors. So it's only direct care staff and supervisors. You may wonder if any administrative staff should be reported here. And the answer is no, it should only be direct care staff. But note that any admin or any other types of staff, we will get that type of information from you from the total cost tab. So for the purposes of this tab, if you kind of just scroll left to right, you'll see that, for example, the row in orange over here is an example, and you'll see that in many tabs. So we've tried to give you an example of how you may report some of this information. Here we ask you to report the job titles, so the jobs your organization employs. So in this case, they are DSP, for instance. In column D, we do ask for you to identify the location, the borrower, the census area, because we recognize that especially if your agency is a multi-region agency that serves multiple services across multiple regions, we kind of design the ability for you to report whether those wages are the same across all regions. And if that's the case, there is an all option. But if they do vary from region to region, we ask that you explicitly identify it over here. So in this case, for example, we have the DSP wage for Anchorage. So you do have the ability to select a specific area within the state, especially more specifically if the wages vary for staff depending on where they may serve. All right. All of these are bases on which there's a difference in wages based on geographies. However, if there's no difference based on geographies, I would just say select the all option and you could just move on with the rest of the tab. All right. And over here, Sean has like a couple of examples that he's set up so you can see how you can switch between a specific region or all regions within the state. If you scroll to the right, the services, so we asked that you mark X's against the services that are provided. So sometimes there may be an individual, like a certain type of staff, and especially with, I use this as an example for DD services, like DSPs most often provide a lot of the, common residential or non-residential services. So you can mark the X against several services in the row for that DSP. So similarly with some of like the, the age to the physically disabled services, maybe a personal care service provider, or chore provider may be most common, right? So in that case, you can identify the chore provider and select all the services that are associated with the staff that provide those services. So those are the X's mostly for us to understand like which services do these like wages and the staff types apply to. As you move to the right side of the tab, here's where you really get into wages. So what are the hourly wages? So we ask again whether they are direct care or supervisor, employers, contractors. We do ask for the number of positions, more specifically the number of full-time equivalent positions for each staff type. And then in some cases, we know there are stipends or payments, one-time payments that are offered or stipends that are offered, like your family home habilitation service, for instance, where you can identify what the stipend is. And then we get into the wages. We ask for a range, which is the average, but also the low and the high, especially if your agency has a wide range, even within the same region. It helps us to understand whether it's, it's closely knit in terms of like the average low or high, or if they're wide apart. If your agency really has the same wage for a flat wage for all, then you could just mention the same number across all categories. Couple other things we ask here is how the wages have changed over the last 3 years. So we asked for the 3 most recent years, and also for the most, looking forward for 24 to 25, we do ask if there's any most recent or anticipated changes. So if it's recent, you can mention the recent, but if it's not done yet and you anticipate doing it, you can still specify it. And the goal here is also to get insight into whether there are any planned changes in the wages in the near future. All right. So the next few columns are really, we ask for total, like these are essentially total regular paid hours, the number of hours, both overtime and regular, especially if your agency has any pays for any like premium, shift differentials, non-production bonuses, we ask that you report that, as well as the dollar amounts associated with it. So we ask for the hours and the dollar amounts. Those columns look identical, but one is the number of hours and the other one's the amount of dollars. And towards the end, we cover bonuses. So if your organization offers like a one-time lump sum premium of sorts, then you can identify that bonus here within the time span that's identified here, which is the most recent quarter. And then the last few columns are related to training, unfilled positions, or turnover. And some of these additions were also made based on feedback we received from some providers before we released the survey about, more specifically that there may be some, unfilled positions for these certain job types or certain services, and there may be a turnover rate. But again, if the answer to all of this may be 0 or nil, then you can still specify 0 or mark them as any. But with the training questions, if you move to the left, you'll see we do ask for training in the first year, but also training in the subsequent years, because we most often see that, in the first year of employment, there may be more mandatory trainings or required trainings. So the number of hours of training may be much higher than in the subsequent years. So you can split them here, but if they're the same, you can still include the same number of hours in both. All right. So you'll see all in all, this tab, all the columns in this tab ask for quarterly information, but it's just the last few questions. You'll see we explicitly mark them as annual, especially because with training, unfilled positions, or even turnover, we believe that providers, you all will be able to comment on this more, we'll be able to comment on this more specifically on an annual basis rather than a quarter, which may not always give us insight into how the year has been or what this may look like across an entire year. And I'll pause you for questions. I see a comment in the chat, so I am going to take that. And if any other folks have any other questions, please ask us. I did want to say this is an extremely important tab we rely on this group for, so we're happy to take any specific questions. Okay, so the question is, all right, so if any administrators provide any direct care services, you can identify them in this tab. So I did want to say if they provide any sort of direct care services, you can include them here. Like I said, some staff may wear multiple hats and they may serve as a direct care worker, but also in some sort of administrative role. In that case, you can include them on this tab and then identify the appropriate number of hours and the FTE or the full-time equivalent positions associated with them. All right. So that's one thing I wanted to mention. And then so anything related to on-the-job training, if that should be listed under staff training. So if this is related to trainings that they are required on the job, yes. If this is training that is the service itself, suppose these individuals are providing training to, say it's some sort of employment service where staff are providing training to clients, that should not be identified here. This is the number of training hours, the training that staff receive to be on the job. So if it's on the job training to be equipped to provide services, then you can identify those training hours here. These are essentially, but however, if there are, I'm repeating myself, but I wanted to make it clear that if this is training that staff is providing to clients for some sort of service delivery, in that case, that should not be identified here. This is meant to be what staff may receive to be able to perform on the job. Right. Any other questions or comments? I see none in the chat box. I see no hands raised. I'll pause for another 10 seconds before we jump into the next section. Right, that's a good question. So how do you capture the cost of training new staff? So the total cost tab actually has a specific line item that asks you to identify any like staff training expenses that you may incur. So in that case, I believe it falls under program support. Yes, there we go. So line number 37, for instance, says staff training and development, direct care related. So to the question in the chat about how do you capture those costs, you should be able to report them in the total costs tab. But in the wages tab, you only ask for the number of hours. The total cost can be captured in the total cost tab. Right. All right, I see no other questions or comments, and I know we have 30 to go. So I am going to pass the mic to Sean, my colleague from Guidehouse, who will take us to the rest of the training.
Thank you, Purna. So I'm just going to go ahead and jump right into the Programs and Services tab. And this tab is really designed to capture for us the scope of your organization, as well as control some other aspects of the rest of the survey. When you get to this tab, you'll notice there's tab 4, and then we said there's 6 tabs, but there's actually more than 6 tabs because there's a bunch of sub tabs to 4. All of these are related back to this Programs and Services tab, and you really don't need to fill all of these out, only the services you actually provide. So as you come into this tab, you'll go into, and I know we've talked about care coordination quite a bit. If you provide care coordination and a number of other services, this is definitely still, you need to fill out this survey, the care coordination survey, when it any of the same tabs, and you won't need to fill those out at that time because we'll be able to merge that as a supplemental to this. But if you said, yes, we do provide care coordination under the ALI waiver, you would click yes here, and it'll tell you that you're going to get a care coordination survey. For other services like respite, you could click yes here, and it's going to tell you, please complete worksheet 4B, respite. And we can come over to worksheet 4B, and because you've selected that, you'll notice that agency-based is open, and that gold color tells you that this is something you should be filling in, whereas family-directed is still grayed out. And the reason for that is that agency-based, we've clicked yes, but family-directed, we've still got that sitting at no. So if you also did family-directed under the ALI waiver, you'd want to check yes. And as we go back to respite, you'll see that that section is open as well. This is designed so you know what you do need to complete and what you don't need to complete to try and cut down on confusion as much as possible. Also, within those tabs, you'll see up here that this says incomplete. When you've finished filling this section out, this will change to complete. And on the Programs and Services tab, where it says please complete worksheet 4B, respite, that will then also say complete. So this is a good place for you to come back and check and make sure your survey is complete before you try and submit it. And this covers all the different services that are within scope, that are have tabs within the survey, and splits them between waiver programs and state plan services. If you're not sure in other areas of the survey, this is a good place to come back and check what's a waiver, what's a state plan, if you're in doubt. But like I said, Programs and Services drives a number of different tabs, and we'll take a look at a couple of those tabs as representatives of others as we go through. And I'm going to start, because we opened it, I'll go ahead and start with Respite. Respite Services, you'll notice a few things on these tabs. First, there's a time period for data requested. These are all your most recent fiscal year, so whatever you reported as your organization's fiscal year in the first tab, that's how you're going to want to fill these out. They ask for things, in some cases, that you may not track very carefully, like this productivity. We ask for your best reasonable estimates. If you have this data tracked, wonderful. Please give us your most accurate data, but otherwise your best reasonable estimates on something like productivity. How much time percentage-wise does your staff member spend in client-facing services? And we split this up into both in-person as well as telehealth and remote services. Things have changed quite a bit in the last few years, and telehealth is becoming more and more popular. We also asked for some other pieces of information. This is service by service. You'll see very similar things in other tabs. Staff to client ratios, supervisor to staff ratios. So we have an understanding of how many clients are being served and how many supervisors are monitoring each staff member. And we've also asked about staff transportation here, both ground and air. Again, this is a unique challenge to Alaska, is looking into staff transportation by air, as well as some questions on the equipment and supply costs that you require to deliver that particular service. Now, and I'm Porna, please let me know if we have any hands up, but in the interest of time, I am going to just kind of move through these.
Sean, there's one quick question that I
Sure.
will call out. It relates to like the services that are provided. The question is, what if you have a service that your agency is approved to provide on your Medicaid certification, but you did not actually end up providing it during the review year, right? Yeah, so we ask that you identify services that are provided within the year that you're filling the survey for. So if you do not provide the service in that year, that's fine. Like you don't have to identify that within the survey. Just note that, as part of this broader study, we are also working with the state to like review claims data. That will be a part of like any sort of fiscal analysis we do while wrapping up the study. So it will be represented as part of that data. We will be looking at a couple of years of data. So you shouldn't have to worry about a service that you have not provided. And I would stick to the time period for which we are asking this information. So if a tab says it should be the most recently completed fiscal year, identify the fiscal year and give us the services you actually provided during that fiscal year. And then there are questions about what if there has been a significant cost increase from the past fiscal year to now, just general costs, not necessarily linked to the step. Yes. So that's a really good question. So you will see in certain tabs, especially like the total costs tab, we do ask for the most recently completed fiscal year just to get a whole year of data. But you'll see in certain tabs like the wage tabs, right, where we ask for the most recent quarter, like literally the quarter that ended September 2024. And the reason we also do that is because like the wages gives us insight into the latest and greatest, wages, of course, and then the benefits. And when we use the total costs tab, we usually don't use the raw data as is. We would essentially use the total costs tab, which is for a year, as a percentage of wages. So that will also like automatically help inflate what those actual costs are to a time period that is reflective of, changes that may have occurred within your organization. So we would say still continue to provide data from the most recently completed fiscal year. But in your wages tab, if you can really identify how the wages have changed in the last 3 years, Sean has it pulled up over here from AD through AF. We ask you to identify how the wages have changed. So what we will then do is when we get the cost information, we would look at it as a ratio of the wages. So it will also provide insight into how general costs may have increased, even though you are giving us historical data. Any other questions or comments? I don't see any, Sean, so I think we can proceed and I will let you know if we get any other questions.
Awesome. Okay, so moving into I'm going to use the residential supported living tab, but this also covers things like group home. And there's
John,
again the tabs.
sorry to interrupt you there. Can you zoom in a little more so
yes, absolutely.
we can see your screen more clearly? Thank you.
There we go. A little bit less at a time this way. That's fine too. So here we're asking for different group residential home sizes. So 5 or fewer beds, 6 to 16 beds, or 17 plus beds. And we didn't select this in our programs and services, but so you'll notice everything is grayed out. But as you select this, all these cells will open up. And we've asked just how many homes your organization operates in each of these categories so we can get an idea of scale, as well as number of occupied beds in your fiscal year, vacant beds in your fiscal year, unique clients. We've also asked about your staffing. On these days, on average, how many staff members do you have during, full-time staff members do you have during the course of the total day? How many FTEs, if you will? Similar questions with supervisor span of control, client transportation, as well as staff transportation here, and vehicle details for the home. So, how many vehicles do you have if you operate a fleet? What size vehicles? So we have an idea of what those costs are to transport your clients and your staff around as needed. Again, all of these are to try and really zero in on your costs for providing the service so we can get you a rate that supports those costs. And the third representative tab we definitely want to talk about is meals. Now, of course, if you are a meals only provider, you can fill out the meals only survey, and all of the rest of these 4 plus a letter tabs, these sub 4 tabs, won't be part of your survey. You'll just have this meals tab. But either way, whether it's the full survey or the meals survey, we've asked the same questions. How many sites you operate. We've got some questions in here about Title III revenues, waiver revenues, questions splitting out your home delivered meals versus your congregate meals, and then asking a series of meal delivery costs in a very granular way, what each of these different aspects of delivering a meal costs you. And that could be, bulk meal transport, packaging costs, your building space, square footage. These are all really important pieces to what it takes to deliver a meal for you. So we want to be able to build each of those pieces in as needed. You'll notice one question here that I do want to point out is this question 34. One of the lines is question 34. You'll notice this will be grayed out if you either if you do home delivered meals or congregate meals in isolation. But if you select that you deal with both of these, this will open up. Just as do the above costs include congregate meals. So if you're not able to separate your home and delivered and congregate costs, we know that they're rolled in together. Some questions about the number of meals, and then also donated services that your organization may receive. And I will stop there for just a moment, see if there are any questions before moving on to tab 5 for benefits.
No other questions or comments at this point, but I'll just reiterate what Sean said in that all these blue color tabs are, you will only need to respond to them if you actually offer the service. So we do ask that you take this more sequentially. You fill tab number 4, identify the services you provide, and then you come to these tabs so you will know which ones you really need to respond to. Also reiterating that if you only provide meal services, you can ignore the survey and just pull up the meal survey, because the meal survey is quite like that tab which says meals. It is quite different. It's very specific to support rate development for meals. So you can just respond to that piece of it, and you can ignore all the other tabs in the survey.
Yeah,
I see no questions and no other comments, John. So yeah, go for it.
Yeah, and I just do want to note, we do ask costs again here in the meal delivery costs as separate from the total cost tab. Meal delivery costs, we've gone much, much more granular with this to really understand the cost of this particular service. So please do respond to this section, but only with your meal delivery costs, with those specific targeted costs. I will go ahead and move on to benefits. Benefits, you'll notice, is not grayed out because we don't need to be able to select this one in programs and services. Everybody gets to fill out benefits. And this is a great time to emphasize again that this survey is not at the end-all be-all of our data. It is a great way to get an idea of where you are right now. We'll also be comparing the information we get from your surveys to other data sources as benchmarking locations, so that we see where you are right now, and where you need to be as we're building the rates. But we ask a number of questions here about benefits that you may offer. Fill this one out in particular with, again, your direct care staff in mind, full-time and part-time direct care staff. We ask how many people you employ, and then a series of questions about your health insurance premiums, both for individual and family coverage, how much of it you cover, how much of it your employees cover, what that split is. We also ask about dental insurance, vision insurance, to understand what the full healthcare coverage package is that you provide currently. We ask about retirement coverage. Do you offer a 401k? How many staff receive that? Do you offer a match of any sort? We ask about other benefits you may provide. Do you offer long or short-term disability coverage, legal insurance, pet insurance? Yes, that's a real thing. But we want to know what the other benefits are that you provide and how much that costs you, because again, that's total part of your total wage package to your employees. Your unemployment insurance and workers' compensation, and then also how many days are you offering your staff off as personal days, vacation, sick time, holidays, because that's, again, a part of their total compensation package that you have to realize. So we want to make sure we're accounting for that in your total costs. And I'll pause for just a moment before we move on to the additional feedback tab. And hearing no questions.
No comments.
I'll move on.
No questions at this stage. Yeah.
Okay, so this last tab is additional feedback.
Sean, I am going to
Oh,
quickly interrupt you because we did get one question.
Oh, okay.
Is the benefits tab directed only at direct support staff and not administrative staff?
Yes. Yeah, please. This is specific to direct care staff, and then administrative costs are built in a different way.
All right, you can proceed. Thank you.
All right. So the additional feedback tab is both a catch-all for any information that you didn't have, you felt we needed to know more about some input that's in this survey. You wanted us to know about the specifics of licensures that you're working on, or that you need. But it's also an opportunity for you to tell us anything that we didn't ask about, things that you feel we need to know, things that you feel would make the program better or run smoother. This is an opportunity for you to tell us all of that stuff. And yes, we really do read this. We'll be summarizing the results from it for the state as well. So please give us all the feedback that you think would help us make the programs better, because we do really read it, we do really summarize it, and we really do bring it to the state. And we've gotten a lot of help out of this tab before. So any information that you feel like we need to know more about an input, or that we need to know something about Alaska, your integration with the program, and things that can be improved. We like to hear it all. And with that, I can pass it back to you, Poorna.
All right, thank you, Sean. And just reiterating with the survey workbook, again, you all have seen it today. And if you have any specific questions, you can reach us. But more specifically, if you do not have the survey to date, please drop us a note at the email ID I've put in the chat box. I will pop that up again on our screen shortly. Sean, let's pull up the slides to wrap up our conversation on just what next in terms of both the timeline, but also in terms of the technical support that Guidehouse can offer as part of the survey response period. Okay. So, all right. So, like with this, let's move to the next slide, and then the next one. So, covering some in terms of the survey logistics and support. So, where are we today? So, essentially today we are at the last and final survey training session, more specifically for the 2 surveys that have been released. The LTSS Provider Cost and Weight Survey General Survey, as well as the Meals Only Survey. Keeping in mind that this timeline does not capture the care coordination or the targeted case management survey, which is coming up in the near future. But specifically for these 2 surveys, it was released on October 11th. If you do not have access, you will get access if you drop us a note. We had a training session last Monday and today. The training recordings will be made available to all providers after the session within the coming week. And then we ask that you submit the survey back to us by December 13th. The December 13th is basically the survey submission date or the deadline. And over the course of this period, there are several ways through which we can offer technical assistance. But before I jump into that, I do see we have a question more specifically as it relates to the survey. So I'm going to pivot to the question and then we'll come back to how we can provide support through the survey response period. All right, so the question is basically that, an organization mentions that our employees accrue paid time off based on the years of service. I'm not sure what number I'd put here. The longer you work for the organization, the more off you accrue. That's a really good question. So in terms of what we ask for in the survey, we do ask that you report the average number of days across all your staff. So if, for example, if we ask for the number of paid time days that staff eligible to receive during a year, we ask that you give us the average number of days a staff would be, eligible to receive, if you may. But this is a really key piece of information. So we do have an area within the tab where we ask for other benefits, and there's an area where there's a specify box where you can give us more information. We ask that you provide information either in that tab or in the additional information tab, where you can share with us how the paid time off days vary based on staff tenure or the number of service they have within your agency. If you can identify the range, saying, if they have X number of years, then it's X number of days, or if it's, Y number of years, then it's Y number of days. So if you can identify what that range looks like based on the years of experience in a specify box or in the additional information tab, that will provide us some more insight into, what that range looks like within your agency. But in terms of the yellow boxes within the survey, where you ask for the number of paid time offs, we just say that you report the average number of days across the different types of direct care staff and irrespective of the years of service within your agency. Right? And please do keep the questions coming. I know we have 8 more minutes. I will proceed with other resources we have, but we are happy to take on more questions if you have them. Right? So all in all, you'll see it's essentially a 2-month period, a little over a 2-month period between when the survey is released till when you can submit the survey back to us. All right. So moving to the next slide, I'm just talking about resources that are available over the course of the study. So in terms of, firstly, as you're responding to the survey, some tips and tricks to respond to it. We do say at the beginning of this discussion, we did say when you open the survey, you hit the enable content button. We do say you click that button before you start, because we've noticed that sometimes we've had providers ask us questions about not being able to access the content. It's because you have an enable content. So definitely do that. And then we do ask that when you're responding to the survey, specifically, the survey does focus on wages, benefits, costs, service delivery information. So that's just for you in gist what it covers. So you can choose where you want to start and where you want to finish. And overall, we have received questions about, is the survey mandatory? Do we have to take the survey? And our response to that is we strongly encourage you to participate in the survey, because the survey allows you to give us information on what service delivery looks like in reality on the ground and what your costs are like in the recent past. So that information can then be used by us in aggregate to inform the rate development process. And I always say this, the analysis is only as good as the data. So we do rely on the data that we get from you all as part of the study. So we encourage you to participate in it. We also ask that you encourage other providers and if you're part of associations, to encourage the providers that are part of those associations that provide long-term services and supports to participate in the study, because it does ultimately, essentially benefit the rate development process and anything that may come after that. This is a comprehensive rate development process that goes beyond a rate rebase. A rate rebase is a key part of it, but we are also looking at several other elements of the study, and we do rely on the data that we get as part of the survey. And overall, of course, you mentioned a few tips and tricks here. We've emphasized some of these already in terms of, save your survey frequently so you don't lose the information as you're responding to it. Because sometimes you may want to start the survey in one day and maybe finish it several days later. So you can save your progress along the way. Do look into identifying the services that you provide first, because that really tells you what else you need to provide in the survey. All right. But all in all, we do say that the survey is extremely important to us, and it is an opportunity for you to provide information to us that can essentially feed into the rate study and the rate development process. And jumping into the next slide, we'll briefly talk about essentially beyond today's training session, what are the other resources available to you? So these are live webinar trainings, of course, but they are being recorded, and the recordings will be uploaded to the DOH website and made available to all attendees of today's call, but also all the other providers that have received the survey, should respond to the survey. And as long as we have your email ID and you've attended one of these sessions, you will get access to the training, and you'll get access to the link. It is a publicly available training session, but we will send you a link of the training once it's available on the website. Outside of that, we will be circulating a frequently asked questions document within 2 to 3 weeks from now. So all the questions from today's session are extremely valuable, and we are hoping it will benefit the product provider base by means of the FAQs. And if you do have any questions for us over the course of responding to the survey, please send us an email to the dedicated mailbox, which is akratesstudy_LTSS@guidehouse.com. We do monitor it, and our goal is to get your responses within 2 business days. So we encourage questions, especially early on in the process. So it allows you to kind of plan for what you may need to meet over the course of the survey response period leading up to December 13th. And there are instances also where we may choose to schedule a meeting with you, so we're able to clarify a little more if it's something that may be a little more complex to clarify over an email. So these are the resources for you. And with this, I will just wrap up with survey submission. The survey submission date is December 13th. And we ask that you send the survey response to the email ID that's developed, that's identified over here. And in your survey response or your survey workbook, we ask that you also include your agency name in the workbook. Again, if you do not do that, we do look at your surveys and we can identify them, but it's much easier if you're able to include the name of your agency in the survey workbook when you send it back to us, and we do monitor this mailbox. So once we get the survey, you should get a confirmation receipt from our end that we have received the submitted survey from you. All right. So there are a couple of questions now I know over here, but what is the overall goal of the rate development information gathering? So we covered this a little bit at the top of this discussion, which is essentially some broader goals of this rate study and through this provider surveys to get information directly from providers so it can inform the rate development process. So a couple of goals of this is it will inform a rate rebasing process, but that rebasing is not just, a rate increase or a rate change, and that's the end of it, right? It would be considering every single component that goes into the rate. So Sean, if you move a couple of slides forward, I actually have an appendix slide, the last slide in this deck, that kind of goes into what are the different components that go into the rate, right? So this is exactly a framework I'm sharing with you all, but it's essentially different building blocks that go into the rate. And the survey essentially captures information as it relates to these different building blocks, whether it's wages, benefits, productivity, etc. So the goal from the survey is to be able to capture information that can inform rate development. So that's the key piece of why we're asking for the survey. While we are aware that there is an annual cost survey process for a few providers, the survey is a little more, the survey we are conducting with the one-time survey is a little more extensive, that asks more information, like Sean and I went over today around service delivery. We ask for staffing ratios and transportation costs, and whether there are differences based on geographies within your agencies, and whether there are anticipated changes as it relates to costs or service delivery. So the overall goal is to capture that information, get that information from you so we can analyze it, aggregate it, and then help inform this sort of rate build-up process for each service. And this may also help us inform any potential new services that may be similar to existing services. And those will also be conversations we will have as part of more focused provider work groups. All right. But hopefully that addresses it. And I will also say, if you were not part of the initial part of today's discussion, I know DOH provided some context in how this study came about. And we also covered how the study will ultimately, how the survey today will ultimately feed into the rate study and the, the overall goals of the rate study as well. Any other questions or comments? I know we are at time, but I'm happy to stay on for another couple of minutes if you have any questions or comments. But if you all have no other questions or comments, please feel free to drop, and note that we will be distributing the recording of this training so you have offline access. And please make note of our email ID in case you would like any questions clarified offline, one-on-one, or if it may strike you after today's session, we are available for any sort of technical assistance after the meeting.
And Purnell, I'd like to interject with two quick things here. First, when you get this study, before you start filling out the survey, pro tip, one of the first things you should do is resave it with your agency name attached. That way you have a separate copy of it, what you know you're filling out, and it'll have your agency name attached when you send it to us. And second, kind of going to that question that we've gotten, should I fill out this survey? Absolutely, because how will we know what's going on with an agency just like yours unless we hear from an agency just like yours? So it is really important to hear from everybody, large agencies and small, even very, very small agencies, so we can see those differences and understand everybody's struggles in the process.
I see that there were some more questions about like staffing and what if questions for staffing is not applicable. So you will see, I would say, take that service by service. We do ask some general questions about, the staffing ratios, like how many clients are typically served by a single staff at a single point in time. How many staff are supervised by a single supervisor? Or we also ask for like staffing ratios if you operate like residential services or group homes or residential supported living. We ask what that may look like across different like sizes of homes. Again, if you do not operate certain sizes of homes, you can leave those blank or you can mark them as like zeros or NAs. But if you do operate homes of those sizes, then we ask that you respond to the questions appropriately. But if you have any other specific questions as it relates to your agency, please feel free to get in touch with us so we can, whether it's staffing questions or anything else, we can respond to it more specifically as it relates to your agency. And as we wrap up, I did want to say we thank you all for joining today's training session. We appreciate you for carving out time in your busy day to be a part of the session, to learn more about what the study is, but also asking us thoughtful questions, because especially a lot of the questions asked today, I think will really feed into informing a lot of the providers who are not part of today's session or who may not have thought of these questions at this point in time. So it's been informative for us as well to gather those questions and share them with the broader provider base. So thank you all for joining us today. We will keep an eye out for your surveys and your questions if you have any. Just keep in mind December 13th is a deadline, and we'll look out for your survey and feel free to get in touch again if you have any questions. So thank you all.